Okay, everyone, Dr. Scott Bland back here with you. I know we've been on a bit of a hiatus, but I was working on something and I have recently become certified in obesity medicine. Now, it is one of the more complicated and misunderstood things in the universe, the science and the data and the hormones behind how do we help deal with the disease of obesity. And one of the things that I was thinking was the big argument in obesity medicine is, well, how do you actually handle the argument of calories in versus calories out? Does calorie restriction actually work? There's a lot of data out there that if you do it, it works fine, but that just telling people to calorie restrict, it tends to be rather ineffective because frankly, we don't tend to do it. And then the arguments of BMI versus, actually doing body fat percentages. And I figured, let's just go ahead and make me a guinea pig, okay? And if I'm gonna be a guinea pig, what better way to figure it out than to just go ahead and put myself on a calorie restriction diet, use the higher protein stuff that I've got access to, and just try and track how I do on 30 days. Now, if you look through how people tend to calorie restrict, there are many people who do different levels. There is what we would consider a low calorie diet, somewhere in the range of 1,200 calories per day. And then there is a very low calorie diet, pushing down towards 800 calories per day. Now, if you look at someone who's done a bariatric surgery, certainly there are some different metabolic or absorption issues that can be caused there that can reduce weight. But one of the major ways that bariatric surgery tends to work is it just structurally enforces a calorie deficit. It literally sets your gastrointestinal tract up to the point where you physically cannot eat the number of calories that you used to eat. So what I figured is I'll go ahead and I'll put myself on the most restricted diet and we'll just track my weight and track all that sort of stuff. Now, one of the things I need to be very specific about here is if you're watching this and you're saying, oh, Dr. Bland, I'm going to do it too. I am 100% not your physician just because I'm on YouTube. I am not establishing a physician-patient relationship with you. I'm not advising that this is a great idea for you. There are a number of medications, particularly if you have diabetes, that can be literally dangerous for you to drastically calorie restrict without adapting your medications. So no major diet plans without talking with your physician. Nothing beats a relationship with a physician that you can talk to face to face. So, having said that, let's go through some of the experiment that I'm going to do. And we're going to start with acknowledging that BMI, just literally the calculation of the height of you versus the weight of you standing on a scale, is a pretty mediocre process. Now, one of the things that is becoming far more affordable and far more useful and known is the idea of calculating your actual fat percentage. And one of the more common ways to do this is using an impedance measurement system. And what this does is it sends electrical impulses through your body and it calculates based on that and the fact that fat mass, adipose tissue has different resistances than muscle mass, different resistances than water, and it calculates all of that and it gives you a pretty decent idea how much of the weight standing on the scale, when you stand on the scale, how much of that is muscle, how much of that is water, how much of that is actual fat tissue, and then it gives you a more basic idea of how you're doing. I know we have all had moments where we have convinced ourselves that as we gained 5 pounds, it was probably because we were lifting, and it's probably muscle mass, and it's definitely not, there's no chance that it could be fat tissue. And I figured one of the best ways to go through this is to just literally eliminate any of the mystery and do an objective test. So I physically went and I paid for an in-body test. I want to be super clear, not necessarily endorsing in-body as I'm saying this, it's just the test I had access to. There are plenty of other impedance things that you can use. I also find that DEXA scan is still considered the gold standard. That's literally an X-ray process, and that's the by far the most accurate that most people have, but you can avoid the radiation issues and stuff like that if you just use an impedance measurement system. I use in-body. And to show you some of the disconcordance or the differences between dealing with BMI, which is height versus weight, and dealing with your actual body fat percentage using an impedance system, let's kind of show you where I'm at here right now. Now, I am classified as an overweight rating, okay? So I have the disease of being overweight, if you're using the terminology of the Obesity Medicine Association. I'm not self-conscious about that. It is what it is. So currently it says my BMI, if you just do the math of the height versus weight, my BMI comes out to 28.6%. Then if you look at percent body fat, and that's literally what percent of my body sitting here right now is fat mass, okay? that percent is actually 30. So what it's actually saying is, I am definitely not someone who gets to pretend that, no, I only qualify as heavy BMI because I'm carrying so much muscle. That is not the case for me. I literally am just carrying, I'm carrying fat tissue. And for me, maybe you're in better shape than I am. For me, it tends to focus around my belly. That actually happens to be the place which is considered most risky in terms of where you're carrying your fat mass, in terms of health issues and all that sort of stuff. So we're going to see how I do on 800 calories a day. Now, part of the issue, and we're going to talk about this in a follow-up video that I'm going to do. Dr. Peter Attia put out a questioning the pros and cons of the GLP-1 type of medications. That's your Wegovy's, that's your Mounjaros, your Ozempics and stuff like that. And they've been drastically getting a lot of news for weight loss, which they're very good at. But the things that we want to point out is that those can have issues with losing muscle mass. And a lot of folks say, no, you can't do calorie restriction because you'll lose muscle mass. So one of the things we're going to be doing, and one of the reasons that I found using an impedance measurement was a really good idea, is because I can actually track the amount of skeletal muscle mass that I lose. So right now it's telling me that I have 63 pounds of actual fat tissue on my body. That's what this is telling me, right? And I have 39 pounds of dry, lean mass, okay? So we'll see over the course of time. I'm gonna do another one of these scans at the end of 30 days at 800 calories. I spent my first day doing that today. Frankly, I'm a little hungry, not gonna lie about that. I'll be pretty frank about my opinions through this. I'll do some shorts every day to talk about my reactions, how I'm doing, struggles I'm having, did I kind of break the diet at all? We'll go through that. And I'll give a little more descriptions in the future about some of the things I'm doing. I'm going to be using literal clinical meal replacements. I'll be working on setting up an obesity medicine practice here in Arkansas at some point. And one of the things that I'll do is I will offer that for folks who like the freedom of not having to deal in the immediate with having to change all the prepping and cooking and stuff. And while they're busy learning the new way to eat long term, they can temporarily free themselves of some of the burden of doing all the cooking by doing like clinical meal replacements. And these are high protein in relation to the calories that are there to try and curb how much of the weight loss is actual skeletal muscle, because you're not wanting to lose a bunch of that. You're wanting to lose more of the fat, maintain as much of the muscle as you can. And we'll see how this does over 30 days. And who knows, maybe I'll get to the end of this and I'll say, I was a bad example, this didn't work, but maybe it'll work great. But we're gonna process this, so because I feel if I am part of a medicine association that talks about this is occasionally useful, it's probably a good idea if I know what it feels like to go through that. So we're gonna be along for the adventure. If you have any questions about this, anything that I said sparked up a thought process that you have, a concern you have, man, leave it below. I'd be happy to talk to you about it. And feel free to join me on this journey for the next 30 days as I do less than 1,000 calories a day for 30 days as a doctor, monitoring my actual fat and muscle changes, monitoring my weight, daily check-ins. Here we go.